I want to talk to you a little bit today about glucose on your blood work. So when we go to the doctor, because it's either like some kind of annual checkup, or maybe it's because we have symptoms and we want them to pull some blood work, one of the markers that is typically on what they call a complete metabolic panel is fasting glucose. Now, this information gives us some insight into like a progression of symptoms that can generate disease, that can end up in some type of diagnosis. Okay, so glucose is just one of many markers that the doctor's looking at, but most often when your glucose comes back in the 90s or in the low 100s, they'll just say, oh, that's normal, everything's fine, we'll see in 6 to 12 months. But in some cases, when it's like 110 up to 120, around that range, they might use terms with you like possible insulin resistance or pre-diabetic, meaning that you are on the way to developing a diagnosis of type 2 diabetes. Typical response to this marker being elevated from a doctor's perspective is typically going to be either remove carbs or reduce them drastically, so change your diet, and possibly also some form of medication to keep that glucose lower, okay? The deal is that carbs are being demonized for this problem in your blood sugar that may not necessarily be their fault. So there is a place where there's someone who's eating literally like garbage, like they're eating chips and cupcakes and all sorts of stuff that's just like really processed foods, high in carbohydrate, high in fat, low in nutrient value. That will obviously have an impact on your health. But if you're someone that is eating like a really clean diet, like focusing on proteins and healthy veggies, and you're exercising and your glucose is high, there's something else going on. So I want to talk to you about two different aspects of carbohydrates and how your body utilizes them. So the first one is going to be that it treats any carbohydrate as a source of energy. Okay, so that's either a candy bar or kale, doesn't matter. All right, it's going to be converted into glucose, which your body will utilize to create ATP in your mitochondria, which is a form of energy. Now, it gets into your cells by the help of insulin, which is a hormone that your pancreas releases when glucose levels go above 89. So even if your blood glucose is in the 90s, you're going to be pumping out insulin to shuttle that glucose to the cells to create energy. When the cells are not wanting any more of that, or they've taken in all that they can, the insulin takes the excess glucose to the liver, where it is either converted into glycogen and stored in your liver or your skeletal muscles to be used as a later date, or it's converted into a triglyceride and stored in fat. Sugar being stored in fat cells is definitely a conversation for another day, but don't blame fat for what sugar did. That's what I'm going to say on that. But the second thing I want to talk to you about is that concept of the range of carbohydrates, meaning a candy bar versus kale, for example. They're both carbohydrates, but they're both going to impact you very differently. First of all, that candy bar has a lot of added sugar in it and not a lot of nutritional value. And so it's going to be converted much more quickly, and the impact is going to be much, much greater than kale, which has lots of different nutrients and minerals and vitamins in it, but it also contains fiber. And that fiber is going to cause it to be digested and absorbed much more slowly and at a much lower level. So a candy bar is fast and high, and a kale is low and slow. And so that's going to impact the overall burden on your blood sugar regulation. Okay, so let's roll this back a little bit to how glucose is affecting those possible diagnoses of insulin resistance and type 2 diabetes. Now, as with all things, there are genetic markers to everything and genetic impacts. The beautiful thing is that diet and lifestyle can actually help to prevent certain genes from being turned on, or in contrast, turn some genes off. So don't, throw out the baby with the bathwater if there's some type of genetic influence that you feel is affecting your blood sugar. We also don't want to remove all carbs, because some carbs are going to be very beneficial. So we want to look at the type of carbohydrate that we're eating. But when I'm looking at this, I'm actually looking a little bit more deeply at things like how insulin is being used in the cells and how your cells are able to respond to that glucose and actually utilize it. And then I'm also looking at liver function in terms of how it is creating those triglycerides, or even in some cases storing it as glycogen. Our glucose levels impact many different areas of our health. Everything from energy production to being able to sleep to hormone production, keeping our hormones balanced. There's definitely a, cascade effect of dysregulated blood sugar to many other metabolic issues that are more comprehensive. It affects cardiovascular health, it affects your weight, it affects your hormones, the list goes on and on. The benefit here is that there's hope. You don't have to get on medication or give up all of your favorite foods if you know how to utilize them well in your diet and if you know how to support your body with better lifestyle choices. So diet and lifestyle are going to be very crucial to managing this blood sugar issue. And in some cases, there may be supplements. But one of the things that I want you to take away from this is that it may not be the food's fault. It might be how your body is using the food. So if you have symptoms like low energy, fatigue, brain fog, if you have trouble sleeping at night, if you are dealing with crazy hormone imbalances like hot flashes, night sweats, crazy periods, crazy mood swings around your period, all these things can be impacted by blood sugar. But this is something that we work on every single day with my clients in my Naturally Nourished program. So in there, we are looking for the hidden causes to why you're having these symptoms, okay? And blood sugar is key to that. Blood sugar balance is something that we're looking at. But I don't just stop there. I don't just stop at, oh, look, your blood sugar's high. That's why. I'm like, why is your blood sugar high? That's the difference here, is that we don't just stop at one level and go, oh, well, it's this. I say, why is it this? And we keep backing up until we get to the bottom of it and then can fix it from the ground up, giving you back your energy, helping you lose weight and just feel better. So when we're looking at other causes for glucose to be dysregulated that aren't necessarily related to your diet, but that are creating these symptoms and this cascade effect that leads to diagnoses like insulin resistance and type 2 diabetes, metabolic syndrome, high cholesterol, cardiovascular concerns, all of these things, right? One of the key starting points is in regards to minerals, because minerals act like spark plugs for every single function in your body, affecting every area from your energy levels to your digestion, to your mood, and to your metabolism. And I don't just mean like metabolism in terms of whether you are able to lose weight. I'm talking about metabolically how your entire body is able to function well. And so for the month of June, I'm offering a discount on a lab that I run for every single client in my Naturally Nourished program that tests mineral balance in your body. While this test is included in my program, I do offer it as a single session, and ordinarily it is $360 for the lab and a consult about the lab where I review it, give you all my findings and tell you what's going on with your body, right? But for the month of June, I'm offering it on sale for $199, and I only have 10 spots available for this sale. Okay, so I'm going to put a little slider here, and if you're interested in knowing more about this test, knowing about whether or not minerals might be what's going on with your blood work and your symptoms, I can reach out to you and give you more information and chat with you a little bit about how this lab might unlock some of those hidden causes of the symptoms you're experiencing that are ultimately keeping you from feeling your best and losing weight.